Welcome to the lesson 4 of the FN Green Skills for Nurses Planetary Health course. In this lesson, we will focus on empowering healthy lifestyles for planetary health, with the main focus on nutrition and physical activity. This lecture aligns with the core competency tree to empower individuals, families, and groups towards healthy lifestyles and self-care. Health promotion and empowering healthy lifestyles are fundamental aspects of nursing. Often, the choice between being sustainable and investing in health is presented as an either-or decision. However, there are health co-benefits of sustainable lifestyle. Sustainability and planetary health interventions have the ability not only to improve the environment and protect the planet, but also to improve the health of populations and your patients. The EAT Lancet Commission points out the interconnectedness between nutrition and production of food. Human food consumption and the production of this food have impacts on both human health and environment. Environmental changes from unsustainable food production in turn will impact human health again. In simple terms, what your patients eat will impact their own health and the health of the environment they live in. To start with, we will look at the health consequences of unsustainable food consumption. Food is unequally distributed across the globe, with more than 820 million people undernourished, but at the same time, 2.1 billion adults are overweight or obese. The rising prevalence of overweight and obesity also leads to a rising global prevalence of diabetes, which has almost doubled in the past 30 years and will most likely continue to rise. On the other hand, there are huge environmental impacts of food production, as agriculture occupies about 40% of the all global land. Additionally, food production is responsible for up to 30% of global greenhouse gas emissions. This means there are lose-lose diets, diets that are both unhealthy for the humans who eat them and unhealthy for the environment in an unsustainable way. Environmental degradation resulting from these lose-lose diets might further exacerbate poor health. Negative effects include premature death caused by poor air quality from biomass burning for agriculture and land clearing, reduced food security resulting from low yields due to changing climate conditions, diminished nutrient content of some crops due to the rising atmospheric carbon dioxide concentrations, and famine exacerbated by extreme weather events such as droughts. This is why it is important to shift to a planetary health diet. The UN estimates there will be 10 billion people by 2050 in the world, and to feed them all in an healthy way, we need to start creating healthier and more sustainable diets. The planetary health diet is flexible. It recommends intake level of various food groups that can be adapted to the local geography, culinary tradition, and personal preferences. It recommends consuming a range of food that will promote health and well-being by reducing the risk of overweight, obesity, and non-communicable diseases. Shifting from unhealthy diets to the planetary health diet can prevent 11 million premature adult deaths per year and drive the transition toward a sustainable global food system by 2050 that ensures healthy food for all within planetary boundaries. For nurses, there are many opportunities to get involved. You can conduct dietary assessments of your patients by assessing their individual diets as a standard clinical evaluation. This will help address specific nutritional needs according to their age, sex, comorbidities, and physical activity levels, and requires added sensitivity towards the needs of vulnerable groups. Monitoring changes in individual diet quality over time continuously and alongside their nutritional requirements can support long-term healthy lifestyle changes. You can promote the planetary health diet while also giving special considerations to vulnerable groups such as expectant mothers, children and adolescents, and individuals suffering from chronic diseases. Furthermore, you can support education and training by actively participating in education campaigns in schools and other public services to promote the planetary health diet. Nurses are trust, and your input can have a tremendous impact. Including nutrition and food systems in the nursing curriculum as main determinants of health is important as well. Lastly, you can help by changing the food procurement practices of your healthcare institution. By getting involved with the work of your institution's procurers, you can ensure that food procurement and provision activities minimize food waste and food loss in healthcare facilities. And finally, you can advocate to your community, your healthcare institution, your national nurses associations, or to the EU institutions. Next, let's turn to nutrition. Physical activity is a major determinant of health. As a nurse, you can have a big impact by promoting healthy lifestyles. Mobility influences health in many ways. Physical activity has been well documented as having a positive impact, a positive effect on, for example, cardiovascular health, mental health, and obesity. The way we are mobile, the way we travel, also has an impact on health, as motorized travel contributes to sedentary lifestyles of individuals and also leads to the air pollution and noise that harms everyone in the community. Active travel, on the other hand, which is travel on foot or by bike, can improve levels of physical activity with all its health benefits and avoids those harmful emissions and air pollution. Mobility can also influence the environment as emissions from traveling by car are harmful for the climate, with CO2 being one of the major greenhouse gases that accelerates climate change. We design our environments often to accommodate cars rather than humans. Paved streets and cars in the streets contribute to the urban heat island effect, which again can have health impacts, especially on vulnerable groups. The design of the cities is often not for pedestrians or active mobility, but made to fit for cars or other motorized transport. This is not only promotes an healthy lifestyle, but also increase health inequity, with poorer communities living in areas which are less green and more polluted, while privileged communities travel by car, contributing to the air pollution. As a nurse, you have a high impact on the lives of your patients, and you can encourage their physical activity. Nurses have a role to promote healthy lifestyles and prevent disease. You can make every contact with your patients count towards a healthier lifestyle. You can also learn about nature-based solutions and green prescribing, which uses nature for the benefit of your patients. You can actively educate your patients on the benefits of active mobility and the harmful effects of the air pollution and the sedentary lifestyle. Now, how does nutrition and food production influence the health of your patients? How would being physically active improve your patient's health? In the next lesson, we will learn more about environmental health impacts, including air pollution, heat, and vector borne disease.